This show is brought to you by the Chiropractic Broadcast Network. Check us out on the web at chiropracticbroadcastnetwork.com. And hello, everybody. Welcome to this edition of Tuning into Health. My name is Dr. Chad Rohlfsen, right here from Des Moines, Iowa, and this is episode number 174. Oh boy. Long weekend, I know. I didn't do a show yesterday. I didn't feel like one. There wasn't much news going on, so I thought I'd give it a little break on that last Monday. Sorry about that. That's all right, though. Oh boy, lots of stuff happened this weekend. I spent 20 hours sitting in continuing education credit hours, and about the biggest waste of time I could ever imagine. But the state laws require that we be there, so suck it up. Anyway, we got lots of news for you today. Bird flu may not be so deadly after all, the boy who cried wolf says. But don't worry, there's some fear there. Flu season's just beginning. It could ramp up quickly. Sleeping pills linked to almost a 4-fold increase in death risk. Megadose vitamin D might ease menstrual cramps. Whoa! Wait to see how many international units this is. No extra benefits seen in stents for coronary artery disease. What the heck? Man. Vitamin D inhibits inflammation. And condom use. Basic errors are common. Gosh. Tell you what. Oh, this is cool. Sounds delicious. New study links between pitch and flavor. Oh, and a vaccination rights attorney is being gone after, threatened with criminal charges in New York State. Demands that she surrenders names of all clients. You know what? What's this world coming to? We got a lot of that and more after this. Everybody. Again, this is episode number 174, Tuesday, February 28th. Tomorrow is February 29th. So, happy birthday to all of you folks out there that have a birthday on the 29th, because it doesn't happen that often. So, what is that, a leap year? So, hey, we got a lot of data for you today. It kind of makes up for yesterday, because there just wasn't anything in. I came to work yesterday with intentions to do a show, and I just started looking at the stuff out there, and it was in fact just a little disheartening, because there just wasn't too much. So what do we go after here this morning? I'm going to leave the vaccination news at the last part, because this patient rights attorney is being threatened with criminal charges in New York, and I think that needs a little special attention, because that is a bunch of crap. That is definitely a bunch of crap. So it's a what do you call it? Intimidation tactic. So, and it's a move to restrict your access to our legal rights systems, a fair and legal rights system. So. Anyway, hey, did you know the poor are in fact less likely to sue their doctor? This comes from Science Daily, February 27th. Contrary to common perceptions among physicians that poor people sue doctors more frequently, Ramon Jimenez from the Monterey Orthopedic and Sports Medicine Institute and his team demonstrate a socioeconomically disadvantaged patients, in fact, tend to sue their patients less often. Their work suggests that this myth may exist because of the subconscious prejudices of stereotypes that often affect thinking, decision, and decision-making without doctors being aware of it, a phenomenon known as unconscious bias. So this is an article that was published in the Clinical Orthopedics and Related Research. So, wow. But some physicians believe that as a group, low-income patients tend to sue their doctors more often than others. But the mindset has potentially negative effects for doctor-patient relationship, according to some physicians reluctant to treat poor patients or treat such patients differently from their other patient group in medical case terms. Wow, this is interesting. Sleeping pills linked to almost fourfold increase in death risk. Sleeping pills, the same ones prescribed by your physician, are supposed to ward off a myriad of health problems that could come with lack of sleep. But adults who take sleeping pills in small numbers over their lifetimes may be 4 times likely to die earlier compared to those who are not prescribed sleeping pills, according to new studies findings published in the Monday British Journal of Medicine. And those prescribed sleeping pills may also be more likely to be diagnosed with cancer, the study found. Imagine that. Imagine that. It's all about a natural quality of sleep. Sleep is very, very essential part of your health and wellness. But I think there's something more than just being unconscious. There's sleep where your brain is active still. It's the REM sleep and all this type of stuff, and you go through the beta, delta, and theta waves, or theta and delta waves, and all that type of stuff. But there's a difference between a chemically induced sleep and a natural sleep. And what we notice here in the chiropractic profession is one of the most common comments that we get after we see a new patient is, I slept for the first time in a long time last night. I slept better than I have slept in years after that adjustment and all that type of stuff. So that's what we're doing, is we're getting the stress off the nervous system so your nervous system can relax. And we're leading to greater brain efficiency, according to functional MRI studies, and all that type of stuff. So I tell you what, getting an adjustment will help you kick those sleeping pills, because your 4-fold increase of dying if you use sleeping pills. So hopefully you can get off of them. Megadose vitamin D may help ease menstrual cramps. Now, okay, vitamin D has been all over the news for the past year. And oh my God, it's the miracle drug. And it's basically the same vitamin that you get from going out in the sun. But everybody's so freaking scared about going out and exposing themselves to the sun. It's ridiculous. Everything in moderation, right? But small studies suggest that women plagued by menstrual cramps may find relief with the vitamin D, raising hopes that dietary supplement could one day be an alternative to the painkillers and birth control that doctors now recommend. But the treatment involves megadose of vitamin D of 300,000 international units, which made experts add "Don't try this at home" warning. So that's like the vitamin D that I take has 800 international units, and I'm thinking I take about 6,000 a day. Can you imagine? I can't imagine taking that much vitamin D in a day, especially on a regular basis, like once a month. This study does suggest that vitamin D may have a role in menstrual cramps and menstrual pain, but I certainly would not recommend taking this dose this high at present time. Dr. Joanne Mason, who heads the Division of Preventative Medicine at Brigham Women's Hospital in Boston. The jury's still out. Actually, there's been reported dosages of much higher than 300,000 international units, which, that'd get pretty high. The highest dosage I think ever recorded was 1 million, and that was from a mother who misdosed her child. And even he got sick, of course, because that's a lot of vitamin D, but he had no ill effects from it later on. I mean, he got sick, which your body should respond, but then that was 1 million international units. This is 300,000. I'm all for supplementing or getting natural sunlight. But a lot easier thing that you could do would be go to visit a chiropractor that is comfortable in dealing with these problems of menstrual cramps and menstrual pain. I usually tell my practice members there's a chance that we could help your menstrual cramps. And usually what I found is that it takes about 3 months. It takes about 3 cycles. And if we get started, usually the first cycle, if it's in within 2 weeks, it'll be really heavy, like, oh my gosh, what's happening here? And then the second cycle cleans up, the third cycle cleans up even more, and then the next time they have their menstrual cramps, you don't even know they're coming. They just appear. So that is with the women in my life that I take care of, including my wife, which she's, I don't notice any increase in emotional agitation or anything during her cycles or whatnot. And she had that same experience because when we started care on her, she had awful menstrual cramps. Awful. That would put her buckled over for a week at a time. And after we started care, it just disappeared. It was nice. Let's see. No extra benefits seen in stents for coronary artery disease. Common practice in inserting a stent to repair a narrowed artery has no benefit over the standard medical care in treating stable coronary artery disease, according to a new review of randomized controlled studies published on Monday. The stable coronary artery disease is the type of heart ailment that causes angina or chest pain after physical exercise or emotional stress, but generally not at other times. The review did not include studies of emergency use of stents for heart attacks. So stent implantation involves a procedure, blah, 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 blah. So this is not the emergency type of stents that they use. This is like, the artery's a little narrow. So they did an outcome study, and it didn't pass muster. Researchers viewed 8 randomized trials, and it didn't pass muster. Even with the daily aspirin and ACE inhibitors, combining data from all studies, researchers found that prescribing beta blockers, ACE inhibitors, statins, and daily aspirin, now standardized treatment for stable coronary disease, was just as effective as stent implantation. Wow. Vitamin D again. Science Daily, February 23rd. Researchers in National Jewish Health have discovered specific molecular signaling events which by vitamin D inhibits inflammation. In their experiments, they showed low levels of vitamin D compared to levels found in millions of people, failed to inhibit the inflammatory cascade, while levels considered adequate did not inhibit inflammatory signaling. They reported their results in the March 1st 2012 issue of the Journal of Immunology. The study goes beyond previous associations of vitamin D with various health outcomes. It outlines a clear chain of cellular events. Now, I'll tell you what, folks, because of all this good news with vitamin D, you've really got to watch out because there's going to be hucksters out there promoting their vitamin D, which is a bunch of crap. And usually the type of vitamin D that the medical doctor prescribes is a bunch of crap because it's a vitamin D2, and it's not as effective as vitamin D3. Vitamin D3 can only get from sunshine and a certain specific type of supplement. You can find those supplements. You can find vitamin D3. You can find it on Amazon. But what I do is I would suggest that you get a good relationship with somebody who's comfortable with nutrition and so they can get you on board with the right type of supplementation there. Hey, condom use 101. Basic errors are so common, a study finds. But first, we're going to go with this.
Do you have itchy, dry skin? Struggling with acne, eczema, asthma, or other health problems? Or maybe you're just looking for a safer, natural alternative to cleaning and skincare products. Maybe it's finally time for you to make the switch. What do I mean? A vast majority of skincare and cleaning products today contain toxic synthetic ingredients that are having a devastating effect on our health and our skin. But there is a better way. At Genuinely Pure, it's our mission to provide 100% natural and safe products that you'll absolutely love, and provide them at affordable prices. We offer a full line of products for the body, face, home, and baby, all full of pure plant-based organic ingredients to nourish, heal, and rejuvenate your skin. So now are you ready to make the switch? Come check us out on the web at genuinelypure.com. Find us on Facebook or follow us on Twitter. Place an online order with the promo code Dr. Chad to save 10% off your purchase. Make the switch to Genuinely Pure today.
And you are tuning into Health with Dr. Chad.
And we're back. Hey, I would really advise you folks to check out Genuinely Pure. They're just rated best natural skincare products in America by the Taste Awards on the Food Network. So really, it's a little company right out of here of Huxley, Iowa, and the people are genuine. They are pure, good people, and I would suggest it's a little business that she started up right out of her own kitchen, and it's grown into something bigger. And it's some of the best skin care products that you can get in the United States. So visit genuinelypure.com. If you use the promotion code Dr. Chad, you save 10%, which is awesome because they are awesome themselves. So let's see. Okay. Because practicing on a banana is not, sorry to segue into this, but because practicing on a banana is probably not adequate, I guess, I don't know. Condoms can't prevent unwanted pregnancy and suggested sexually transmitted disease if they're used incorrectly. And I'm thinking, how do you use one incorrectly? Unfortunately, the new review of the research finds that common use errors are all too common. And I don't understand how they did this research. Some of the most frequent mistakes include putting a condom on part way through intercourse and taking it off before intercourse is over, failing to leave space at the tip of the condom for semen, blah, 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 falling to look for damage before use. These errors can contribute to breakage, leakage, and researchers report that the Journal of Sexual Health. So, we chronically underestimate how complicated condom use can be. Okay, I guess there's more to it. Hey, this is kind of cool because you know me and sound, right? Oh, by the way, what I saw this weekend when it came to chiropractic education, which is sanctioned by the American Chiropractic Association, makes spinal tuning look mainstream. And yeah, it put the bug in me to get the spinal tuning thing up and running and whatnot and bring it to the masses, because I tell you what, if they're ordering CEUs, credit hours, for what I just saw this weekend, spinal tuning is, yeah. Okay, never mind. I'll just shut my mouth there. Sounds delicious. A new study shows link between pitch and flavor. What? You think a Pinot Grigio smells like a note from a clarinet? Does the sound of a bass taste like a dark red Barlow? If so, you're using cross-modal associations drawing on analogies of various senses in order to create a picture of the world. And you're not odd. A new study from Oxford University scientists show that the taste and sound are intimately linked. An extreme form of phenomenon is synesthesia, a condition in which one might see the number 8 as red. For example, most people would make such cross-modal associations all the time without giving it much thought. Imagine yourself on one side of a small hill when suddenly you hear a very loud, deep-toned thump coming from the other side. Your brain instantly assembles a picture of the shape and size of the object that made the sound. You know, this puts stuff into a little bit more light for me, because I really like wine, and I really hate it when I get a good bottle of wine or a good glass of wine, and I really enjoy it, and then later on I want to have the same type of wine, but it doesn't taste the same. And maybe that's because of my audio awareness. I am very aware of audio, and Could it be that what I was hearing when I drank that first glass of wine that tasted so good changed my whole sensory apparatus to like the wine, and then when I had it in a different environment, which I was, hearing something different, it wasn't as good. I noticed that with whiskey as well, because whiskey, for me, will change its taste even from the same bottle. And it's really strange because you can notice different flavors come out and all that type of jazz. And there'll be some times where I just can't drink what I'm tasting, or I can't drink the rest of a small nosing glass of whiskey because it just doesn't taste good. And that could be a factor of what I hear is what I taste. So I'm glad they came out with this study, because that makes a lot more sense to me, because I've never been able to really enjoy the same wine twice consistently. And a lot of people say, well, that's the year or whatever. No, it can be from the same year. I'll get the same year bottle of wine, and I'll have a great time with the one bottle, and then I open up the next bottle a little bit later on, and it doesn't taste the same. And it must be from what I hear. It's interesting, I think. I think it is. Hey, Sanjay Gupta. You know Sanjay Gupta. I think, is he from ABC? I don't watch him. But, man, this dude, hey, he looks like, look at his face here. Boom. The serious medical doctor. I'm on TV. So he's giving the House MD look. Okay. Wait till you see what he says about prescription medications. This is actually a medical professional.
Sanjay Gupta, MD, CNN Saturday and Sunday morning, 7:30 Eastern.
Like a lot of people, I was pretty shocked to get the news about Whitney Houston.
He doesn't look the
dying
same.
just the night before the Grammys. The coroner says it's going to be weeks before we know the cause of death. That's important. But given her history of drug abuse, people are asking a lot of tough questions. Investigators did find prescription drugs in the hotel room where Houston died. But the coroner told us something very important. Listen to this. Listen carefully. Quote, nothing out of the ordinary was found as long as Houston was taking the medication as prescribed.
6 prescription
as prescribed.
bottles.
That's a key point. As a doctor, I want to dovetail on that by giving you this shocking statistic. 1 in 20 people over the age of 12 take prescription medications in a way that's not prescribed.
I bet it's more than
Another
1 in
key
20.
point, most of them
I bet
are
you.
not addicts. They're just careless, or maybe they didn't heed the warnings they were told. They take too much, they take it in the wrong way, or they combine medications with something else. If you do that, it's easy to make a catastrophic mistake. And
One person every 19 minutes.
Every 19 minutes, a person dies from prescription drugs.
Properly prescribed
Now, this goes
prescription
far
drugs.
beyond what may or may not have happened to Whitney Houston. I want to be clear on that. But I also want to talk to you about the dangers that everyone faces at one point or another. Joining me from New York to talk about this is Dr. Petros Lavonis. He's Chief of Addiction Psychiatry at St. Luke's and Roosevelt Hospitals in New York City. Thanks for joining us. I imagine, Doctor, you, like everybody else, have paid attention to the story of what happened with Whitney Houston. But I did want to sort of make a couple points here. I want to ask you about them. Even legitimately prescribed medications can kill in combination with other drugs and sometimes alcohol, but even just small.
Okay. I'm going to stop it there because you can watch this on your own. But he said even medications can kill when they're prescribed with other drugs or used with like alcohol and whatnot. Tell you what, the average senior citizen today is on, what's the latest figure? 8 to 12 different medications. The average senior citizen is on 8 to 12 medications. Plus, they don't stop drinking alcohol as well. So if you look at some of the quality of life in some of the nursing homes around, oh my God, I'm not going to end up like that. No. Nope. I tell you what, if that ever happens to me, I'll steal someone's car and drive it off a cliff. That will be the end of me. I tell you what, I wouldn't want to live like that. So, damn it, they got these locks on the doors there. So it's little mini senior prisons that they're in now. Anyway, hey, flu season just beginning. Could ramp up quickly. don't be calm about this, folks, because they're ramping up the fear on you. This came out February 24th, at the time when lots of Americans usually are coughing, sneezing, aching, and feverish with flu. Doctors' offices and hospitals have been surprisingly quiet so far. February is usually a month with the U.S. flu cases peak, and more common becomes sick than any other day in the month. Than any other month. But the U.S. Centers for Disease Control, the people who would hire Bill Bibb, say that this year's flu season has only just begun. So the latest season start was in the past 29 years. So, wow, Epidemiology and Prevention Branch of Interconference has estimated. So officials typically declare the start of flu season once the number of respiratory specimens testing positive for flu rise above 10%, which usually happens it doesn't take into fact that they could mutate. Anyway, vaccinations rights. No, I'm not going to do that one yet. Bird flu may not be so deadly after all, a new analysis claims. After scaring the crap out of you, bird flu may be far less lethal to people than the World Health Organization's assessment of death rate topping 50%, scientists said, in a finding that adds fuel to the heated controversy over publication of the bird flu research. Scientists led by virologist Peter Plazzi of Mount Sinai School of Medicine in New York argue that the analysis published in the online edition of the journal Science that the WHO, the UN agency, and the calculating the death rate using the estimated human bird flu cases, that is simply too low. So Plazzi and his colleagues did not offer a specific death rate for people infected by bird flu, but based the figures on the site. That's because it's not science, folks. These people are not living their world in science. They are living their world in consensus. So this bunch of smart people suggest this, so it must be true. The thing is if the smart people don't have the right data, it doesn't matter how smart they are, their conclusions are wrong. And that's how come they miss the flu season so often. Because there's 161 serotypes of flu, 162 now, 163 because of Yahoo in frickin' Kentucky made a deadly one. So, he made it out of his frickin' laboratory. So anyway, vaccines rights attorney Patricia Finn threatened with criminal charges. New York State demands that she surrender names of all clients. Vaccines rights attorney Patricia Finn is being targeted by the 9th Judicial District of New York State, which has threatened to strip her of her license to practice law and even file criminal charges against her. Finn is one of several vaccine rights attorneys across America who helps parents assert their rights to protect their children from potentially serious deadly effects. Vaccines. She considered a hero by many, but a villain by the status quo for daring to stand up against vaccine pimping medical police state that they exist in America today. I personally interviewed Patricia Finn for an InfoWars nightly news last night. During the interview, I saw and read the documents that contain charges being leveled against her. From Prison Planet TV, subscribers can watch the video at prisonplanet.tv. One document described her vaccine rights advocacy as threatening the public interests, asserting that helping parents legally and ethically avoid toxic vaccines somehow puts the public at risk. This accusation makes absolutely no logical sense, of course, given that even the vaccine pushers claim that their vaccines offer absolute and total immunity against infectious disease. That their vaccines offer. Therefore, how can an unvaccinated child ever threaten the health of a vaccinated child? That's what I've been saying all along. But idiots out there, and if you're an idiot, I'm sorry. But if you're an idiot, and if you think that an unvaccinated child can threaten the health of a vaccinated child, you're an idiot. But doesn't it make your head scratch? Don't make you scratch your head when your child's frickin' sick all the time and the unvaccinated children that you know of aren't sick all the time? It's not due to the unvaccinated child. It's due to the vaccine, you idiot. So quit being an idiot and look into this a little bit more deeply. This is going to be, interesting. because this could go all the way to the Supreme Court. And if she's a vaccine advocate, that means she likes to fight, and she could take this all the way up the chain. So it's going to be an interesting thing to watch. So, hey, bring it on. If they want to bring it on the legal court system and all that type of jazz, common sense has to kick in somewhere. And it might as well kick in the Supreme Court. And this could do wonders for the vaccine advocacy movement. So we're not anti-vaccination. We're pro-information. So if anybody calls me an anti-vaxxer, screw you. I just want both sides of the information so I can make an informed choice for my children and their health and myself and my health. So to call somebody who wants both sides of the information anti-vaccination is incorrect. So it's you who doesn't want to look at both sides of the information and make an informed decision. And, it just goes back to Nazi Germany. Yeah, it does. Yep, it certainly does. So on that note, I tell you what, we got one down, and I hope you have a wonderful day. Hopefully, I got to take some more continuing education credit hours, and I can be more discernible about what I take. But, you got to take them when you can. What happens when the state gets involved and takes away? Yeah, never mind. I know. Life sucks sometimes. Sometimes you have to suck it up and smile. Anyway, I hope you have a great day. I'll be back hopefully tomorrow or Thursday, depending on if there's any particular news I want to share with you. If there's not, I won't be back there. I'll be back the next day. I'll kind of let it accumulate. I want to get at least more than 5 stories that are interesting to share with you. Sometimes there's not. So, hey, I review the health news articles every week, so you don't have to. I go over thousands of articles and just kind of give you the brief overview. And that's so you don't have to. And you can use the information by going to facebook.com/Rohlfsen and getting the gist of some of the articles that I push there. So, and you can push them to your social network as well. So, hey, on that note, yeah, drop a comment. So if you want to see something different on this show, please let me know. I'm up for all suggestions. Kind of at an impasse of how I want this show to go and all whatnot, so it's a good thing. But otherwise, I want you to have a great day and adjust for the health of it. Bye-bye.